care through some technology solutions. We have a panel to discuss that today, but before we get started, I'd like to set the tone and outline some of the terms, some of the reasons that have brought us to this time in healthcare. For me, really, the story starts with my father 50 years ago. This is my father beginning medical school. You can see his black bag, and actually throughout his residency, he made house calls. He went to go see people in inner city Philadelphia. He delivered care and took care of them. This is no longer what physicians do. However, there has been a rebirth in this idea of taking care of people in the home. But some of the concepts that are evolving now are unfamiliar to many, and I'd like to just cover those. Notably, physicians have gone from a self-employed practice to an employed practice rather dramatically. And the Wall Street Journal and others reported at the end of last year that it was the first time in American history that most physicians were actually going to be employed as opposed to self-employed. And the reasons for this have to do with the new models for care delivery. So we're evolving from a fee-for-service model where if I as a provider do something to you, I get paid, to one that is value-based. And I, for one, feel that this is an imperative that we have some sort of value-based care delivery models. The incentives simply are not aligned. It makes no sense for us to be taken care of based on a simple transaction, do something and you get paid, rather than a wellness model that your care providers have to provide some sort of guarantees, if not for an individual patient, but for an aggregate. Hospital-based care is also now being replaced. So traditionally, people were admitted to the hospital for an acute episode and discharged. The focus now is on the continuum, managing the patient as they go from home to hospital, back to home to clinic. And as we look at the structure of this, it's called an accountability care organization, or an ACO. So ACO is something that you're going to be hearing more and more about. Some people almost use this interchangeably with some of the principles within the Obama administration's proposals for healthcare delivery. So again, what we're trying to do here is manage the patient's continuum as they go from acute care to less acute care inpatient, to rehab, to home. And then a large organization has to aggregate data around not necessarily a single patient, but an aggregate of patients to make for an ACO, and they get paid by the government and other payers based on the value that they're able to show that aggregate. Now, one might ask, why is healthcare so broken? I personally believe real plan in mind. And so we're now stuck in this mousetrap, this quagmire of things that have just been kind of kludged together. A lot of people point at health information technology as the savior for this. EMRs, things of that sort, where we can see what we're doing and better understand the processes. I am an informaticist. I focused on technology, but I actually focus on another aspect of technology, which I think is equally important, and that is collaboration. The ability to take information and put it in front of a care team. I'm very concerned that the level of information is too much for a single individual to fully understand, and they need people in real time to best know what are the next steps for a patient. What can you do when you can provide this opportunity for collaboration, what some call telemedicine? I believe what you're actually providing is reassurance. If you can scale the skill level of provider from nurse to generalist to specialist, if you're able to provide reassurance at the bedside, you can avoid expensive overutilization of services and expensive transfers. Because when you think about it, what we all really want when we're sick is reassurance that it's all going to be okay. That's what the sick patient wants. That's what their loved one wants. That's what the nurse wants when they're unsure about a medication, or a generalist wants when he has not seen a particular disease before. They want someone who's seen that to come and tell them it's going to be okay. Reassurance. That is really what the opportunity is for collaborative cloud-based services in healthcare. Now, I'd like to just note that payment for this has evolved. Many people ask, how do I get paid? Face-to-face, whether virtual or in person, is felt to be a meaningful transaction with the same billing codes by many payers now, and this is a big change. This is true for Medicaid, not so true for Medicare, but you're seeing an evolution of this, and you're certainly going to see this evolve more as we go to employer-based systems and consumerism in healthcare, where consumers are demanding convenience as well as care. Many people have focused on the left side, the fee-for-service models in telehealth, stroke, second opinion. I've actually become more and more interested in the right side. How do you manage the entire continuum from the moment that patient touches the hospital all the way through the hospital admission, all back into home where we can deliver services to the home in a sustainable way? I think there are true opportunities in this space to improve care cost effectively. The medical home for me is a place that you stay and others come to visit you, providing a higher level of care. And we're seeing opportunities spring up where lower level providers are going into the home, checking on patients frequently, but then they're pinging um, other providers over iPads and simple devices, asking them, I have a problem, what do I do? Can we begin diagnosis and treatment while the patient is in the home rather than transfer them to the hospital? This is a big cost savings, but it's also an improvement in care from the patient's point of view. Reassurance can play a role in a variety of models, from inpatient all the way through to home care. Some of us have talked about using schools as an opportunity to provide reassurance for children's health, for students, but there's a variety of places where reassurance can play a critical role in improving healthcare. Today we have a set of panelists. Dr. Tomenkin from United Healthcare is going to talk about the vision that United has. Deb Dahl from Banner Health is going to talk about some of their really extraordinary work that they're doing to improve virtual care. Phil Gordon is working with a large organization, very technology focused. And finally, Lindsay Kroll is going to talk about some of her work in leveraging a patient navigator that basically makes certain that all the resources are available to patients.